So how do you use an AED? Howdy, I'm Kiram. This is CPR for Noobs. I'm the Chief Medical Officer at Polaris, and I'm going to give you some tips today on how to save lives. Let's do it. So the AED is super simple. They made it so anyone could figure out how to use it. Once this thing is on, once you turn it on, it actually runs the show for you. It tells you exactly what to do, so you just follow its orders. It's really quite amazing. So it's kind of idiot-proof in that sense. So even a noob could handle it. You turn it on, and it tells you what to do. So it'll tell you to plug in the connector, right, once you turn it on. So first step, turn it on. Next step, it'll tell you to plug in the connector. Next step, it'll tell you to attach the leads to the pads. Your AED may come with these already plugged in, but you attach them. And then it'll tell you to attach the pads to the patient. Nice little pictures showing where they go. So they really make this as simple as possible for you. All right. They're adhesive, so they stick. Now some AED notes, all right. Let's say this person was super hairy and you place the pad, put it on their chest, and it's basically just touching the hair. You're not going to get a very good shock in that situation. So you actually need to rip off the hair from the body. If you have a razor, that's great. Otherwise, there'll be some spare pads, okay? There'll be some spare pads with the AED. You put one of those on, and then you just give the person a quick wax, and you rip it off. And then you don't use that pad because it's full of hair. Discard that pad, get a fresh one, and then use that one. You've got to have good skin contact with the pad to deliver the shock effectively, okay? So keep that in mind for that. You also don't want water all over the chest because when you do the shock, it'll actually arc over the skin and it won't be as effective. It'll burn the patient, but it won't be an effective shock to the heart. Other notes when you use your AED, you don't touch the patient at all when the AED is analyzing. So after you turn it on, plug it in, put on the pads, it'll now say, be clear of the patient analyzing heart rhythm or something. So if you're touching them, you're going to confuse the AED. So when it's analyzing, don't touch. Then it'll give you some sort of a recommendation. It'll either tell you A, continue CPR, which means continue doing chest compressions, or B, it'll tell you to shock the patient. And before you shock the patient, make sure you're not in a pool of water, because then the shock will, it can shock you. So nice dry surface. And make sure you're not touching the patient, because when you press the shock button and you're touching the patient, you will also get the shock, and that could also stop your heart, and then you'd be out. So that's a really important point. When you're analyzing the heart and when you shock the patient, make sure no one is touching the patient. And the AED also usually reminds you of that. It'll tell you stand clear, don't touch the patient, press the shock button. Okay, so that's what you'll do. So it'll either tell you to do CPR, do chest compressions, or press the shock button. And then every 2 minutes or so, or every 5 minutes, depending, it'll tell you to stop doing CPR, stop doing compressions, and it'll tell you it's going to analyze the heart rhythm again. So it's always trying to see, okay, is the heart fibrillating? Is the heart fibrillating? Let's check, let's recheck, because if it is, then you could shock the heart. And then there's a good chance the person can come back if you get them early enough with the AED. If you get them early enough, their heart is fibrillating, you shock them, there's a much better chance of survival. Otherwise, it just tells you to keep doing CPR, which means the compressions. So the CPR is the backbone, and then the AED, if the person qualifies, if their heart is fibrillating, you can shock them and then hopefully bring them back. So again, once you turn this thing on, it's going to bark orders at you the whole time, so you're not going to be confused. But the main idea is have someone get one of these right away. So whenever you start compressions on the person, have someone call 911, have someone else get your AED, and when they come, you attach it to the person. You'll have to stop CPR for a moment to attach the pads, but then you get right back on it. So that's what an AED does, and that's how you would use it. And as you can see, it's pretty simple.